Hi, I'm Dr. Thomas McGinn, the Executive Vice President for the Physician Enterprise here at CommonSpirit Health. Today is Tuesday, June 21st, and welcome to the 5-Minute Check-In. As always, we're going to discuss COVID across the United States, and here at CommonSpirit Health, we have a special guest, Dr. Lawrence Shield, who's going to talk about a game-changing article that looks at the management of mild hypertension in pregnancy. Finally, on a lighter note, a fun video in honor of Father's Day. So as we take a look at COVID across the United States, we can see that hospitalizations are up 8% and mortality is up over 18%. That's over 300 deaths per day. We are seeing what we're calling an uncoupling of the rate of COVID in our communities and that hospitalization. So we're not seeing as many hospitalizations, but it is on the rise. The good news is that both the Pfizer and the Moderna vaccine have been approved for children between the ages of 6 months and 5 years. So this is really important. The Moderna vaccine is 2 shots, the Pfizer is 3. We really need to communicate with our parents and strongly encourage them to get this vaccine, particularly as we look towards the fall, as children start to return to preschool and kindergarten and things to that effect. We need to remind them while the risks for COVID in children are less, it is still one of the highest reasons for mortality in children. And we need to protect our children and also prevent the spread. Now let's talk with our guest expert on the new article that was just published in the New England Journal on treating mild hypertension in pregnancy. So why don't we switch over and talk about this article that I mentioned earlier in the show and introduce our special guest today, Dr. Lawrence Shield, who is the System Physician Vice President for Women and Infants Clinical Institute. Larry, thank you for joining us today. Really excited to talk about this article.
Great, thanks for having me.
So tell us a little bit, it's about treating mild hypertension in pregnancy, and this was a randomized trial. Can you give us a little context about what happens with hypertension in pregnancy and why are we not treating mild hypertension right now?
Sure. So mild hypertension, defined as a blood pressure greater than 140 over 90 up to 160 over 110, classically has not been treated in pregnancy because of concerns for the developing fetus. Right. This paper addressed that directly and said, well, what if you treat these patients and treat them to a blood pressure of less than 140 over 90 and showed that you improve both mom and infant outcomes. And so in my mind, this is a total game changer. This is taking something that we haven't been doing and telling us we should be doing it.
Right. And tell us a little bit about the trial. How many people randomized? What was the percent reduction in the endpoints?
Right. It was large, multi-center, 2,400 patients were randomized, 70 different sites, and they showed their composite outcome, which included both maternal and neonatal outcomes, a 20% reduction in adverse pregnancy outcome or neonatal outcome.
You know, I was very impressed. You know, I love a good randomized controlled trial, and this was really impressive across many sites and actually a very diverse group of patients, right? Can you tell us a little bit about that?
Sure. The study was actually enhanced to try to mirror the pregnant population that develop hypertensive disorders in pregnancy. So it's enriched for African American population, it's enriched for Hispanic population, but does have a significant number of patients that are non-Hispanic white. So it's a well diverse population. So it should be.
That's great. Yeah. Very interesting. So game changer, right? You said it's a game changer. Tell us, what does that mean in terms of, what do you mean by a game changer? And then what does that mean for you as the Institute head here at CommonSpirit?
So game changer to me is a paper that gets published and then you have to change what you're doing. So this paper is going to reinvent how we treat hypertension, mild hypertension in pregnancy. And as a result of that, we'll be rolling out the recommendations and findings from this study to all of our physician enterprise that provide obstetrical care around our CommonSpirit Health ministry.
Great. I love a game changer. It really, it's just exciting to discuss this with you and that we're going to roll this out. So thanks for joining us and thanks for everything you do for CommonSpirit Health.
Great. Thanks for having me.
And finally, on a lighter note, this past Sunday was Father's Day. So happy Father's Day to all the fathers out there, grandfathers, stepfathers, godfathers, any father of any sort. Happy Father's Day to you. Please click on this fun video link celebrating Father's Day. I'll see you back here in 2 weeks at the next 5-Minute Check-In.